Rosemary, or Rosmarinus officinalis, is an evergreen shrub with needle-like leaves and a woody aroma. Though best known as a food seasoning, it's one of the most popular aromatic and medicinal plants worldwide. Rosemary's essential oil is extracted and sold in small bottles, but despite its name, it's not a true oil as it does not contain a fat. Due to rosemary's oil's use in folk medicine, many scientists are now testing its potential health benefits. In ancient Greece and Rome, rosemary was thought to strengthen memory. Research indicates that inhaling rosemary oil helps to prevent the breakdown of acetylcholine, a brain chemical important for thinking, concentration, and memory. When 20 young adults were asked math questions in a small room diffused with rosemary, their speed and accuracy increased in direct proportion to the duration that the oil was diffused. Additionally, their blood levels of certain rosemary compounds also increased, illustrating that rosemary can enter your body through breathing alone. Similarly, nursing students who were breathing rosemary oil while taking a test reported increased concentration and information recall compared to breathing lavender oil or no essential oil at all. Other research suggests that breathing rosemary and other essential oils may improve brain function in older adults with dementia, including those with Alzheimer's disease. One of the most common types of hair loss is androgenic alopecia, better known as male pattern baldness, though it can also affect females. Rosemary oil treats androgenic alopecia by preventing a byproduct of testosterone from attacking your hair follicles, which is the cause of this condition. When men with androgenic alopecia massaged diluted rosemary oil into their scalp twice a day for 6 months, they experienced the same increase in hair thickness as those who used minoxidil or Rogaine, a common hair regrowth remedy. Additionally, those who use rosemary oil reported less scalp itching compared to the minoxidil, which suggests that rosemary may be more tolerable. Other research indicates that rosemary oil may fight patchy hair loss, or alopecia areata, which affects up to half of the population below the age of 21 and about 20% of people above the age of 40. When people with alopecia areata rubbed a rosemary essential oil blend into their scalp each day for 7 months, 44% showed improvement in their hair loss compared to only 15% in the control group who used the neutral oils jojoba and grapeseed. In folk medicine, rosemary is utilized as a mild pain reliever. In a 2-week study, stroke survivors with shoulder pain received a rosemary oil blend with acupressure for 20 minutes twice a day, and they experienced a 30% reduction in pain. Those who received only acupressure had a 15% reduction in pain. Additionally, an animal study determined that rosemary oil was slightly more effective for pain than acetaminophen, which is a common over-the-counter pain medication. For deterring harmful insects that may bite you or infest your garden, you can consider rosemary oil as a natural alternative to chemical products. When a rosemary oil blend-based pesticide was sprayed on greenhouse tomato plants, it reduced the population of 2-spotted spider mites by 52% without harming the plants. Rosemary oil can help to repel certain blood-sucking insects that can spread harmful viruses and bacteria. When rosemary oil was measured against 11 other essential oils, it had the longest repellent effect on mosquitoes, which spread the Zika virus. A dilution of 12.5% rosemary oil repelled 100% of the mosquitoes for 90 minutes. Additionally, a spray containing 10% of rosemary oil was similarly effective as the chemical insecticide bifenthrin for controlling the spread of black-legged ticks, which harbour Lyme disease in tick-infested areas such as northeastern USA. Many factors can cause stress, including school tests. Inhaling rosemary oil may help to reduce test anxiety. When nursing students were breathing rosemary oil from an inhaler before and during a test, their pulse decreased by about 9%, while no significant changes occurred without the rosemary. Because increased pulse rates reflect short-term stress and anxiety, rosemary oil may naturally reduce stress. Additionally, when 22 young adults sniffed rosemary oil for 5 minutes, their saliva had 23% lower levels of the stress hormone cortisol compared to those who smelled a non-aromatic compound. Increased cortisol levels can suppress your immune system, contribute to insomnia, and cause mood swings, among other potential problems. Poor circulation is a common complaint. You may notice it most in your hands and your feet. If you experience cold fingers and toes, even in relatively warm temperatures, rosemary oil is worth considering. In one study, a woman with Raynaud's disease, which impairs circulation, massaged her hands with rosemary oil blend and found that it helped warm her fingers more than a neutral oil. These effects were confirmed by thermal imaging. If you have Raynaud's disease, blood vessels in your fingers and toes constrict when you're cold or stressed, causing them to lose their colour and to turn cold. Rosemary oil may help by expanding the blood vessels, thereby warming your blood so that it reaches your fingers and toes more easily. Rosemary oil is commonly used for mental strain and fatigue in folk medicine. When 20 healthy young adults inhaled rosemary oil, they reported feeling about 30% more mentally refreshed and about 25% less drowsy compared to smelling a placebo. This increase in alertness corresponded to changes in brain waves and increases in heart rate, breathing, and blood pressure. Applying dilute rosemary oil to your skin provides similar benefits as it reaches your brain via this route. In one study, applying dilute rosemary oil to the skin caused 35 healthy people to feel significantly more attentive, alert, energetic, and cheerful after 20 minutes than when using a placebo oil. Preliminary evidence suggests that rosemary oil may help to reduce tissue inflammation that can lead to swelling, pain, and stiffness. It may do so by stemming the migration of white blood cells to injured tissues to release inflammatory chemicals. When people with rheumatoid arthritis were given 15-minute knee massages using a rosemary oil blend 3 times weekly, they had a 50% decrease in inflammatory knee pain in the 2 weeks, compared to a 12% decrease in those not given the oil. Rheumatoid arthritis is an autoimmune condition in which your body's own immune system attacks tissues such as knees and other joints, injuring the joint, causing inflammation. Rosemary oil has antioxidant and anti-inflammatory effects, which test tube studies suggest may fight cancer cells. Animal studies indicate that rosemary oil may stimulate the release of bile, which is important in fat digestion, and activate your own antioxidant defense mechanisms to help protect your liver. Rosemary oil can help to inhibit the growth of certain strains of bacteria that cause food poisoning. This requires using precise, very small amounts of food-grade oil. Rosemary and other essential oils can increase the effectiveness of certain antibiotics. This may allow for a lower dose of these drugs, which could reduce their side effects. Rosemary and other essential oils may weaken the cell walls of antibiotic-resistant bacteria, not only damaging them, but also enabling antibiotics to enter. Rosemary oil can be inhaled or applied topically, It's very concentrated, so you should only use a few drops at a time. The simplest way to inhale rosemary oil is to open the bottle and breathe it in. Alternatively, you can place a few drops on a cloth or a tissue and hold it near your face. Many people use aromatherapy diffusers, which can also distribute the essential oil in the surrounding air. Rosemary and other essential oils are readily absorbed in your bloodstream when applied to the skin. It's generally advised to dilute essential oils with a neutral carrier oil, such as jojoba. This helps to prevent potential irritation of your skin and premature evaporation of the oil. Once diluted, apply the oil to the bottom of your feet or the body part that you're targeting, such as a sore muscle. Next, rub the oil into your skin. This improves blood flow and absorption of the oil. Avoid applying rosemary and other essential oils to damaged skin or near sensitive areas such as your eyes. It's generally advised to avoid rosemary oil if you're pregnant or if you have epilepsy or high blood pressure. Rosemary oil may worsen those conditions. Fresh rosemary is sometimes made into a tea and consumed.